Scan.
Welcome back to Nursing 101. I'm your host, Desi, and today we're going to be doing hanging an IV with also hanging a piggyback. All right, so to begin, we're going to want to check the medication, of course, and the reason why we're hanging the IV, of course. So that's going to be a part of our first of 3 checks we're going to do. We're going to be looking at the MAR, making sure we have the order, making sure it sounds right, like why we're going to be doing this, who we're going to be doing it to. That's going to be our first check of 3. Next, we're going to take our medication and head over to the Pyxis, and we're going to look at the medication to the Pyxis, to the MAR, all of that. That's our second check. Our third check will be at the bedside with the patient, making sure that everything is correct. So that's a part of our 3 checks. The next thing we're going to do is our 5 rights. So when we're pulling out our medication during this time, we're also going to be looking at the patency, the expiration date, making sure it's the right medication, right dosage. So right dose, right time, right medication, right person, right route. So we are hanging IVs. We do not want to be pulling out PO meds. Making sure that all of those are correct. So our packaging was good, our expirations are good. We're also looking at the tools we need, making sure that packaging was good. Those expirations are also good. In this case, we're all good to go. So, moving into the room. When we get to the room, first thing we're going to want to do is perform hand hygiene, get rid of some of those infections. Of course, we're going to knock before entering. We're going to want to provide privacy before even beginning, making sure we scan who's in the room, making sure they're supposed to be in the room. Next thing we're going to do is talk to our patient here. We're going to want to look at the name and date of birth and confirm that verbally, if possible, with the wristband, with what's on the Pyxis and the MAR, making sure that all that information is correct, that we're in the right place and they're in the right place. Next, we're going to be wanting to look at any allergies, making sure no allergies. We did the allergy check. Of course, when we pulled the medication, we should have checked there as well. But this is our second check here. We're going to check and make sure that the wristband is what they say verbally, is what they say on the MAR, and the Pyxis, making sure that all of these things are correct. So we have no allergies to penicillin or piperacillin, which is going to be our medication, so we should be good. Speaking of piperacillin, the things we need to know about piperacillin are that it is a bacterial antibiotic. So it's going to treat any bacterial infections, such as, it can also treat appendicitis as well. So we're going to be wanting to look at why we're using this medication. We're going to also want to be aware that we want to keep it within the therapeutic dosage range. We're going to want to make sure that, of course, there's no allergies to it. We're going to look at making sure that it is helping. So we're going to want to obtain vitals before and after. We're going to assess any fever. We're going to want to assess during the procedure as well that we're not going to have any anaphylaxis or reactions such as rash, shortness of breath, tightening of the throat, any rashes that are going through the body. We're going to want to make sure there's no fever, no warmth, things like that. It can also be indication of infection and that this is not working. So we're going to want to make sure to do those rounds at least every hour, if not more, depending on your facility and the medication and what it calls. The next thing we're going to do is after we've performed ADET, we've done our check and we've checked everything and that we're ready to go, we're going to be looking at our bag. Actually, no. The first thing we're going to do is look at our site. We're going to look at our site. So we're going to be checking for infiltration, which is going to look like coldness, coolness. It's going to look like pallor, any infiltration such as like leakage. We're going to be looking for those types of things. We're also looking for phlebitis, such as redness, warmth, pain, induration. When we want to make sure it's not going to be painful, that we're, no abnormalities. We're also going to be looking for signs and symptoms of infection, which look a lot like phlebitis, but also include pus. So we're going to want to be checking for those. And we are good to go. So we are going to continue. So this is our primary bag. This is just a saline bag we're going to be hanging with our medication. So we've already looked, made sure it's the right place, right time. We've already scanned everything in. We're ready to go. We're going to grab our primary tubing. And typically, this would have a cap on it. And we would have just pulled it out of the package. So we're going to pretend that now. And this also has a cap on it. So we are going to want to do it through aseptic technique, but keeping sterile to sterile. So now that we've pulled the cap off our IV bag, okay, pull the cap off of this. All right, the cap came off. We're going to insert with a push and twisting motion. Make sure you didn't skip arm day. We're going to go ahead and do that. We're going to make sure that all the clamps were closed before we even pushed it in. All right. Woo, getting a little tangly. All right. So all that's good to go. We're going to go ahead and infiltrate our line. So what we're doing is we're just going to make sure that we have the line is infused, that there are no air bubbles, that we squeezed the chamber and filled it to the fill line. Kind of pop this top off here. All right, all the bubbles are out. Making sure we keep in report what we've wasted, all of those things. So we're gonna go ahead and close our clamp now, making sure that we keep everything clean. Typically we would hang it up here, but because we're hanging an IV piggy bag, we're gonna wanna hang it lower than our secondary bag. Go ahead and hang it up here. There we go. Typically, we would connect this to our patient at this time. We would want to check and make sure that there are no issues with the line, and while they're infusing, we're going to pretend like we just connected it to the patient. We're not going to put it in the trash. That would be a waste. So, now that we've connected it and our patient is running just fine with it, the drops are correct, we've calculated all that, it is infusing just fine, we're going to move on to our secondary bag. Again, the process is going to be similar. Both have caps. Pop off both caps. A little bit stronger than I am. Not throw it in the trash. Get a new one. You did. Oh my goodness. Okay. There we go. Okay, be stronger than your bag. Do not skip finger day either. So then pop off both tops. Insert with a popping or twisting and pushing motion. Making sure that, again, all clamps are closed while we're doing this. Remain closed. Hang it higher than our primary bag. And then go ahead and connect. After holding your primary bag, you're going to want to clamp that. So you've clamped it. Go ahead and connect. Okay, now at this point everything is halted. We are not infusing at this time. So then we're going to go ahead and open it up. And then you're going to want to drop it below the primary bag and infiltrate that way. You do not want to squeeze the filling chamber. You're going to want to drop it below the bag and then place it back on top of your primary bag, higher than your primary bag. All right, so then we're going to be doing our checks every hour or more per facility policy or medication type, depending on what's going on. We're going to make sure that we're looking for signs of infections, or we're looking for signs of anaphylactic shock, or that the medication is helpful, it's therapeutic, and it's in a therapeutic range. All right, so now I'm going to perform hand hygiene, get all that, open up, and aid it. And I'm also going to chart how the procedure went, where the IV is, the information, the assessments that I've done, the assessments prior, as well as the assessment after. All right, thank you for watching.